All right, so this is our second COVID Business Ag meeting. We did one last week, and Carol Maurice is on. She was on last week, and she came back for more. So I guess that's, I don't know if that's good or bad. No, I think it's good.
It's
so
good.
hopefully those of you that are listening for the first time today find some value in this. And basically I'm Anne Marie, and Stacy Larson is also on the Zoom as well. We both work in public health. We work in the planning part of the county-wide group that looks at the COVID information, and we just wanted to get on here today and talk a little bit about how to keep businesses up and running during this period of time. So I am recording this. If you have questions, you can type them into the chat box. I will try to address them if it fits as we go. Otherwise, I will address them at the end of the presentation. And then just remember, if you do want to talk, we have a small group today. It's pretty informal. Don't hesitate to unmute yourself and try to get our attention. Otherwise, put something in the chat box if you're on your computer that you need to talk, and we will pause for you to ask some questions. And I think that's about it for me. So Stacy?
Okay. So really the reason that we're here is because I had attended a webinar about 2 weeks ago now, and it was with other counties, working with businesses in their counties on how to keep their businesses going, what to do if an employee would become tested positive for COVID, and just some different scenarios to work with what our involvement would be at the local public health level, and just giving you some information on the whole process of what happens when someone tests positive. We're not going to be making your plans for you on this Zoom meeting. We're mostly just talking about your employees, ways to keep them safe, and ways to keep your business going. So if you're on here thinking we're going to write out plans, we won't be doing that, but we'll be talking a lot about your employees. Just going to give a really brief overview on COVID, because of course it's everywhere. We've all, we can't get away from it. It's a very new virus, probably been around for 6 months. And when we first learned about this virus, we were very much concerned about surfaces and transmission by droplet. And over time, what they have really found is, although it still does go on the surfaces, it's really much more airborne, very small particles. And that is why things have just continually changed, constantly hearing different information. And of course, if you guys are feeling frustrated, we completely understand that. That's why we're here. Don't hesitate to ask questions. And so we're just going to give you some really simple guidance, simple information. And again, if you have questions, don't hesitate to ask. And throughout all of this, what we've really learned about prevention is masks do work, cleaning, social distancing, and being able to work from home if at all possible is really what we would recommend. But of course, a lot of your businesses, that is not possible. So just really wanting to work with you guys so you don't have to shut down if you get a positive test in an employee.
And just a little bit about the numbers. I know we hear them a lot statewide, and statewide the numbers are fairly level or maybe even decreasing in the ICUs. Here in Renville County, though, it seems like we're kind of picking up. We have 16 cases as of this morning, I believe it was, and that's up about 9 in the last week. We were pretty stable there for a while. We had one of the first cases in the state, and it seemed like we sat there and sat there and sat there, and now it seems to be picking up. So I think that that's just important, that it has become easy for us to feel like we don't have it here. I know it's very uncomfortable to wear the masks. I know it's hard to go to the stores and be the only person masked, or it's hard to encourage masking with staff when we feel like it's not around here, but it certainly is around our area as well. And those are our confirmed cases. I'm sure there is definitely a lot more out there as well. So what we want to do is we want to talk a little bit about like Stacy said, symptom monitoring or wearing masks, things like that are one of the best ways that we can make sure that we know that our employees are healthy, and we know that there's asymptomatic cases, definitely. And that's why it's just so important that we have everybody checking every day to see if they're starting to have any symptoms so that we can stop it at the door. Because like Stacy said, the goal is to keep our businesses in our community up and running. We want to provide you with some scenarios at the end of today's talk about what to do if a worker of yours has COVID, or if somebody that came into your facility has COVID. We want to provide you with some of those scenarios, but ultimately we don't want you to have to shut down. You know, a lot of our businesses have been shut down already. And so we are up and running, and we want to keep up and running. We want to keep people healthy, is the important thing. So I'm going to go ahead and share my screen here. And while I do that, I just want to say that if you're a larger business and you have a corporate, you need to follow corporate's guidelines as well. You know, what we say is just general guidelines, but if your business encourages you to do something different, follow that. You can connect with us if you have questions. But the biggest thing, like Stacy said, if you can get people to check symptoms, that's important. And it can be something as simple as this little checklist from Minnesota Department of Health, where you just kind of go through and check if you have any onset of new or worsening symptoms. Fever, the temperature checks really need to be before a person comes onto work. And we know that with people who are working in manufacturing areas or people are working in the fields, that needs to definitely be done before you get outside or into a hot building, because that can certainly increase the temperature. What we would say on this would be maybe a basic level 1 screening is, if it's a no to everything, then whoever that supervisor checks off that Anne Marie checked her symptoms, it was a no, and moves on with the day. But if I had 1 or 2 of these that I checked yes, probably what would be the best thing would be then to refer me to the person at a higher level that is following up with what the exclusions are, maybe somebody in HR, a different supervisor. And so I'm just going to show an example here of what public health uses. We use these. This is our agency just for our employees, and it's a pretty intense survey, I guess, of our day, because it talks about what we would exclude. So we're actually deciding if we ourselves are able to work based on what the CDC or MDH is telling us is appropriate. And so this would be kind of a little bit more higher level screening. But those are just 2 little examples. Again, as we talk a little bit further, it's important to have some type of log so that you know that your staff are coming to work healthy. And then this is just a decision tree. This came out by Minnesota Department of Health. It's not as easy to read as I like decision trees to be, but anyways, it's out there. And what it does, it talks about different columns. In the one column, we can see that it's if people have a laboratory test positive for COVID, what you would do with that person and what you would do with the context of that person. If people do not have a laboratory test, but they have symptoms, what you would do with that person and their contacts. And then let's say a person had COVID-like symptoms, went in and got a different diagnosis from a provider, it talks about what you would follow at that point too. And again, Stacy and I are going to go through some scenarios at the end that really use this decision tree. It says on the top here, it's for youth, students, and childcare programs, but it's really the gold standard for everybody and for people that have anybody working within their agency. So, all right, I'm going to stop sharing here. Pass it back to Stacy.
Sure. And I just want to really impress upon the symptom screening. So many people get hung up on the temperature. You know, we're temping everybody when they come into work, and we tell people that's a really great thing. But if you had 100 people test positive for COVID, only 30 out of 100 would have ever ran a temperature. The other 70 would have had other symptoms and not a temp. So really the temping, in addition to all the other symptom screening, is extremely important, and we cannot emphasize that enough, to be screening your employees so you know where everybody is at on a day-to-day basis. In the event that someone would get ill, you would really be able to track back, you know, how were they feeling the day before? How were their contacts maybe feeling the day before or 2 days before that? So it's a really simple thing. We would not want people to feel like it's an invasive at all. You know, that's a practice we do every day. And in fact, in our home care, we still continue to visit our home care, our elderly clients, and we actually do the same type of screening on them when we get to the visit. In the event that they would be ill, you know, we would have guidelines we would need to follow for them. So I'm just going to talk a little bit about what actually happens when someone gets tested positive. So if I am ill, if anybody is ill, they should just go home. Either they stay home or they go home for a day. Stay home and figure out what is going on. If my symptoms would get worse, say I go into the doctor and they decide, yep, I'm going to be tested for COVID. I get tested for COVID, they're going to tell me to go home and isolate. And isolation is different from quarantining. Isolating means I'm going to be in a room in my home. My food is going to be brought to my room, and everybody else in my house is going to stay quarantined in my house. They can be around the house and in the house, but I have to stay in one room until I get my test results back. Now that could take 3 to 5 to 7 days sometimes to get those results back. And then once those results come back, then they go to your primary doctor, who then in turn gets in touch with you. And then MDH gets notified, and then local public health gets notified. So that's why it's really misleading when we report, we have 2 cases, but they're out of isolation, and people wonder how we could have just heard about 2 cases and out of isolation. They've probably been isolating for the last 10 days. So really what we want to impress upon businesses is staying in touch with that person if they are ill, if they are at all willing to let you know how they're feeling and where they're at, because what you do with your other employees is really dependent on that test result. And what you're gonna do from there. And then if a business would end up with a cluster of positive tests, the Minnesota Department of Health would get a hold of local public health, and then we in turn would contact the business and work with them. We would talk to you about your plan, not gonna be punitive about your plan, but we just want to know, what are you doing for your employees, and just work with you on that. And if there becomes an even more of an outbreak situation, then they're actually going to send out a strike team, and they would come and they would decide if they're going to set up testing in the community or more in your business or things like that. So certainly we can't impress enough. If you have a question, don't hesitate to call or get a hold of us. Even if you have someone who, we had an employee who went home, they got tested. Now kind of what do? We help people kind of work through that, because it could be 5 to 7 days before a test result comes back, and you want to have a plan for when that does come back. What are we going to do now? What's the next steps going to be? And there are steps to do while you're waiting, that staff can be doing while they're waiting for someone's test results to come back.
Yeah, I think the biggest thing that we just want to stress out here too is that if somebody's going home, they might possibly have COVID, or they've called you and said that they do, this is not a time to get highly stressed. It's a time to go back to your plans that you made. What are we doing? Are we staying safe? How can we, beef up what we need to do until we know what's going on? Is there anybody else we need to send home? Things like that. I guess if you had an employee that went home, or you had an employee call back and say that they tested positive or that they were tested, just to double check with them and make sure you knew, did they have the nasal swab and that test came back positive, or did their doctor just diagnose them? Things like that would be questions if they're willing to give you that information. I guess that's up to each person. And then also, just so you know, if you have somebody that has tested positive, 1 or 2 employees that have tested positive, and we haven't contacted you, like Stacy said earlier, it may be that we honestly do not know about them yet, because there definitely is a lag from the time the lab result comes back to the time that we're notified. And so if you're having questions in the meantime, please do not sit and wait for 24 hours, 48 hours for us to contact you. Number one, we may never contact you, unless you have an outbreak in your business, we won't contact you, but we are here to help. So if you have questions, please reach out to us and please let us know, and we're happy to help. So I think we're going to move on to some scenarios if we're ready for that, Stacy. Okay, I'm gonna.
Can everyone see? Okay. So when we go through these scenarios, we have just really told people to think about, Anne-Marie and I are the workers in this scenario, and public health is like our business. And these are all made up scenarios, so nobody needs to worry that this is actually happening, because it's not. So when we go through these, really think about your own business, and maybe think about 2 people in your business that would be like an Anne-Marie and a Stacy, and how this would play out in your own business. And certainly if you have questions, again, write them in the chat box, or you can ask us. So the first one is that Anne-Marie works at Public Health. She knows a guy in town that just tested positive for COVID. His wife was in the office yesterday and talked with 2 public health staff members for a long time. Does Public Health need to shut down, and should all the staff be tested for COVID?
And again, when we say public health, we mean, does our business need to be shut down? And so this is a pretty common scenario that we see because of our small communities. Everybody seems to know everybody. And so in this situation, the wife was in the office yesterday. We don't know if the wife has tested positive. Certainly, the wife should be isolating, quarantine in, what's that? And she should be getting tested, but she may not be positive. So we just need to continue to follow what we're doing in our office, and we should not be all tested by any means, because we have not really even had firsthand, not even probably secondhand contact with somebody.
What we would really want to be doing, you know, we wouldn't shut down, we wouldn't be tested. All we would be doing is just monitoring our own symptoms as we've been doing, just to be aware of that, because we would be almost like third contact to this individual.
Correct. Okay, scenario number 2, Stacy and I work together at Public Health, and Stacy's child has just got diagnosed with COVID. I work next to Stacy every day. What should I do and what should Stacy do? And this is the part where Stacy talked about that social distancing is important if you can have that in your office, you know, having that 6 feet, because what the CDC is now saying is it's close contact is defined as spending 15 minutes together at less than 6 feet apart. And so this can really take out a big office or a big industry if people are closer together for longer periods of time like that. In this particular case, 100% Stacy's gonna have to stay home. I mean, Stacy's kid has actually gotten diagnosed. She lives with that child. She is of high risk to have a, to contract the illness as well. And I guess that's the reason why we're having Stacy stay home for as long as we are, is because she's typically going to develop symptoms within about 5 days from exposure. And so we keep her home for a period of time to see if she's gotten symptoms, and then to see if they've developed into something else. I am, because our business and how our business is set up, I work next to Stacy, but I'm more than 6 feet apart, and we don't have close contact with each other that much. So I'm just going to continue to monitor my symptoms at this point in time.
Okay, in the third scenario, Amory and I work together with 10 other staff in the office. Amory came to work feeling fine, but developed a cough around lunchtime. She worked closely with Stacy all morning. What should Amory do? What should I do? And what should the other office staff do? And again, this is where we tell people, are you close or are you really close? You know, if Amory and I were working together on a project and we were in the same room sitting across from each other, less than 6 feet apart for more than 15 minutes, then we were very close to each other working. So that would be considered close contact. But if we work closely, as in like we're cubicles next to each other, that makes a big difference. So Anne-Marie obviously is going to go home because she has now developed symptoms. You know, we wouldn't even discuss that. She's going to go home and she's going to stay home until she can figure out maybe what these symptoms are. I am just going to continue to work, but I'm going to be monitoring my symptoms because we were in contact with each other. And the other office staff, if they've had no contact with her, they're just going to continue about their day. And Anne-Marie should really just stay home for a full day and see, you know, maybe her symptoms subside and the next day she feels fine and then she would come back to work. Maybe her symptoms get worse and then she needs to contact the provider and go in and be tested. So again, we just tell people if someone isn't feeling well, they need to stay home for a day. They need to stay home for a full day and figure out what it is that they are not feeling well with. If things, you know, because just because COVID is around doesn't mean stomach flu isn't around, or doesn't mean strep throat isn't around, or doesn't mean I just have a headache and the next day I'm feeling fine. We need to really remember that it hasn't taken the place of every other thing you could possibly be sick with. So that's why we tell people go home for a day and then really see what are my symptoms? What am I feeling? Am I feeling better? Am I not feeling better? Do I need to go in? And then the other individuals that you work with are just going to have to really monitor their symptoms, because at this point, we don't even know what Anne-Marie is sick with. So that is where we tell people don't start to panic, because there might be nothing to even do or be worried about. So that individual just really needs to figure out, what am I not feeling good with? And then as a business or a company, this is where you're going to want to stay in really good contact with your staff who are home and who are sick. You know, did you go into the doctor? What is going on? Because then you're going to know what you need to do with the other employees in your business.
Correct. And when we talk about the symptoms, you know, there's some pretty basic general ones, like Stacy said, a headache. I mean, it could be the cotton that's flying all over my neighborhood that's causing me some allergies. You know, it could be some of those things, but we also want to talk about the people that have some of those chronic things, some maybe those chronic coughs, or maybe they're chronically short of breath. So with those people, we're talking about anything new. You know, has it, or a worsening? Has your cough gotten worse? Has your shortness of breath gotten worse? That's where you want to look at with some of those symptoms with people that always have one of those, or somebody that always has a headache. You want to look about, is it different? So I'm going to move on to scenario 4. Scenario 4, public health received a call. So our business received a call from a resident stating that she tested positive for COVID. She was in our office 2 days ago, and Stacy completed nail care on her in a private office room. What should Stacy do, and what should our office do? And again, this is, our office is doing nail care in a private office. This could be your office doing a loan application. It could be a meeting to get a grant, whatever it is. And so we know, because of our plan, that Stacy is to have on full protective equipment. She's got gloves on, she's got goggles, she's got a mask. She might even be wearing a covering, a face shield, things like that. So Stacy needs to just monitor her symptoms. If your facility isn't doing that, if you know you're in an office, you know, doing a grant or a loan application or nail care, and you're with somebody for more than 15 minutes and they've tested positive, that's close contact. That is something different here. That is, yeah, you are going to have to go home and monitor yourself. But in our particular case, we've created the barriers to not allow that to happen. The rest of the office is going to continue on with their regular monitoring of their symptoms and the regular cleaning as our office does. So again, there's a lot of preparation that can go into place that can help you decrease the panic or the fear if you get a patron that calls, or an employee that calls and says that they're positive or have been exposed. Okay, moving on to scenario 5. So my mom tested positive for COVID and she provides childcare for my children. What do I need to do, and what do my coworkers need to do? This case, again, we've talked about a first person. So the first person would be my child. My child is, or my mom. My mom has tested positive. She's the first person. She is providing childcare to my child. My child is with her 8 hours a day. That's definitely close contact. My child needs to quarantine and be at home. Obviously, a child can't stay home alone by themselves, so naturally, either me or myself or my husband would have to stay home. So I will need to stay home because of my child, but also because the other hours that my child isn't with my mom, they're with me. So I'm in pretty close contact as well, and contact with my mom by going and picking up my kids. So this is just a little bit different scenario, but we know this happens a lot, that there are a lot of families that take care of grandchildren, and so that's why we put this scenario on here. As far as my coworkers just continue on doing their symptom monitoring and carrying on, and of course, informing people if they start to develop some symptoms.
And the really important thing that we've learned is it's going to be the close contact. The closer you are to somebody and the longer the contact you have with them, that increases your chances of testing positive. And what we're telling people is not always, like, you may go home, like in this instance, Anne-Marie may go home with their child, and then if she calls her a provider, they may say, no, we want you all to come in and get tested. Then that's what they're going to do. But if for a business, what we're saying is these are the people that really need to go home. They either are going to have to be tested, they're going to have to quarantine, or they're going to have to symptom monitor. Just trying to say, like, not everybody in the entire business is going to have to go home. You know, if I'm working in one corner of the office and someone's working in the other corner of the office and we never have contact with each other, we're really not at risk to each other. It's that really close contact for that shorter period of time where it puts people at a much higher risk. Okay, the 6th one, Amory wakes up, can't reach my thing.
I wake up with a sore throat, headache, and body aches. And per my agency's policy, I notify my supervisor, and then I stay home to monitor my symptoms. But the next day, I now have a fever. I'm just not feeling good at all. So I decide to go into the doctor, and my doctor diagnoses me with strep throat. So in this particular case, I now am in that 3rd column that we saw. I have a new diagnosis that justifies or explains the symptoms that I have. my doctor doesn't feel that I have any symptoms of COVID, that it is all strep throat related, I get the antibiotics, I follow the plan, I make sure I'm fever free and I'm on my antibiotics for at least 24 hours, and then I return to work. So what do the other office staff need to do? Continue doing what they're supposed to be doing. There is no, I don't need to be out of work for 10 days because I had symptoms of COVID, because my COVID symptoms were explained with another cause. So that like Stacy said, those things are still happening. We're still seeing allergies, we're still seeing strep throats, things like that, and we need to, I think we need to remember that.
Okay, the last one is I have a fever, cough, difficulty breathing with walking, and a headache. My sister came last weekend and has tested positive for COVID. I went to the clinic and I tested negative, and now what do I do? Just because I have a negative test, I still have symptoms. So I'm going to stay home until I am symptom-free and without a fever. Typically, people don't get retested. They really just tell them they need to, and I would actually isolate myself because I have these symptoms that would be indicating I have COVID, and I have been in contact with someone who is positive. So I would actually isolate myself to my home for 10 days and wait until I am fever-free for 3 days or symptom-free for 10 days before I would return to work. And, you know, going through these scenarios, and again, we keep talking about the close contact. This is why we tell people why we would prefer people to wear a mask, because it isn't going to prevent every little particle of the virus from passing, but it's going to decrease it significantly. So when we talk about what to do in your business, this is why we tell people you should screen your employees daily, socially distance when you're at work from each other, and we would ask that employees wear masks. There are some executive orders out there that require that employees wear masks. Not every business has that requirement, but that's what we would recommend as best practice. Businesses, like your own private business, you could require that the patrons who come in wear a mask, just like you have to wear shoes and you have to wear a shirt. We have seen signage, people have said, no shoes, no shirt, no mask, no service. You know, that's if that's your own business, that's what you would have to ask of people. That if they're going to come into our business, you know, if you're going to come in and see us, that you need to be wearing a mask. We're going to wear a mask, you know, we're going to protect each other. The mask does not protect you. It protects the people that you are coming into contact with from you. And again, what they have really learned about this virus is it's very much airborne. It's really like if you were, let's say you went to an outdoor bar and you were sitting at your table and someone else was sitting across the other room and they lit up a cigarette and started to smoke, and you can smell that cigarette smoke. If COVID had a smell, that's what it would be. It stays in the air like that. It lingers in the air. And so that is why we are really asking people to be wearing masks. We totally understand. It's not fun. It's not comfortable. It feels weird. But people are really watching. They're watching your business. If you're doing that in your business, they feel safe. They feel comfortable. They feel like this is a place where I want to come because, you know, they're concerned about my health. Same with the social distancing. The farther you can stay apart from each other, the better it will be. Cleaning surfaces is good. We're not going to disregard that at all. But we would say the social distancing and the masking and the screening of your employees are probably the three most important things that you can really do to be monitoring your staff.
So I'm just going to leave this slide up here for those of you that can see it. And this is just kind of what we went through, and it is very confusing. And that's why we want you to know that we are available. Stacy and my emails were on the invitation for this. If you have questions, you can shoot us an email at any time. Otherwise, if you just call the public health number 320-523-2570, we can get you in contact with one of the staff that can, you know, talk about your particular situation and help you resolve it so you're not sitting there wondering what's going on. But this is what we talk about. Person number one, and isolate, like Stacy said, isolating means, you know, they're in the bedroom that has an attached bathroom or something. You know, they're not leaving. Their food is being brought to them. You know, they're just kind of staying in there. Quarantining is person number two. That is, you know, That is, my husband is isolated, I'm bringing him his food, and I'm quarantined to my house. I can still go about my house. My kids and I can do everything. We can watch TV, play puzzles, you know, do whatever we want to do, but we're not leaving our house because we're trying to keep the virus inside of our house and not expose other people to it. And person number 3 is the contacts of mine. So that would be my coworkers that maybe have occasional contact to me. And those are the people that are not necessarily, they don't really need to do anything besides monitor themselves for symptoms, which is something that we all should be doing anyways right now. So I'm going to stop sharing this, and I don't see any comments in the chat box, but if we have gone through the scenarios, and if anybody has any questions, this would be a good time to unmute and we could go through specific questions. All right, not hearing any questions. Like we said earlier, you know, this is half an hour. Hopefully we were able to help answer a couple questions that you had. If you do think of something afterwards, please do not hesitate to shoot us a message. I know Carol was on our first call. She's off now, but she came on for the second to hear a little bit more, and you know, we're happy to share information however we can. So Stacey, you have anything else?
I don't think so. If you guys, we'll give you about a couple more minutes. If you want to ask a question, you can. If you're nervous about unmuting, this is a small group, so
Yeah.
Jordan's not going to talk because his doesn't work. Jordan is in the EDA, and so if you have, he's a very big help too. You can always contact him if you have business questions as well.
Correct. Nicole was wondering, or was telling us that they're taking temperatures. That's great. Yeah. So, you know, again, having staff take their temperatures, but then also having them review the symptom log is important as well. Just because, again, like Stacey said, sometimes there isn't a temperature. And with the temperatures, if people can take them around the same time of the day, that's good too. And use a similar thermometer. So if your agency is just everybody temps upon entering work, well, that's the same thermometer that person's using every time. I know that I have three thermometers at my house, and all 3 of them read differently. So it's just, I just use the same thermometer every day for my temp. And then the forms, can we email over the forms that you have? Yeah, we can get you some of the symptom tracking forms, definitely. So. And Nicole, if you want to shoot either Stacey or me an email, then we would have your direct email address. That would be great. If you can't find it, then just give us a call at Public Health and we will get in contact with you. Okay, I think that does it for this call. Thank you guys for coming on, and yeah, stay healthy.